What do you like? Tell me what you like.
There's value in that because it almost gives the brain like a vacation, right?
Holistic health is completely underappreciated, but so critical. Eating whole foods, and the key is just to find something that you really enjoy.
Welcome to the NAMP Nourishing You podcast. I'm Kristen Burkett.
And I'm Diana Wally. We're your hosts for NAMP's podcast dedicated to connecting holistic health enthusiasts with each other to share practical information from the holistic wellness space for enhanced vitality.
Diana and I are master nutrition therapists, board certified in holistic nutrition with private practices and an online joint venture that supports clients and practitioners as they strive to reach their full potential. We're honored to be hosting this podcast for NAMP and connecting our listeners with the latest in holistic wellness.
And if you enjoyed today's show, help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. We're honored to talk with Dr. James Greenblatt today about holistic support for anxiety and depression. James Greenblatt, MD, is a clinical pioneer, speaker, and health system leader. Dr. Greenblatt is recognized as an authority on improving mental health outcomes with nutritional medicine. Dr. Greenblatt served for 19 years as Chief Medical Officer for Walden Behavioral Health. In 2019, Dr. Greenblatt bridged the medicine and technology space to launch Psychiatry Redefined, an online educational program for mental health providers. Dr. Greenblatt received his medical degree and completed his adult psychiatry residency at George Washington University in Washington, D.C. He completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. Dr. Greenblatt is the author of 7 books, including Functional and Integrative Medicine for Antidepressant Withdrawal. Welcome, Dr. Greenblatt. We're so glad to have you with us today.
Thank you, Kristen. It's good to be with you.
Yeah, we feel really fortunate to have you with us to bring a really different perspective to working with anxiety and depression symptoms. So to get us started, we'd love to hear your story and how you came into the field of integrative psychiatry.
Well, I was fortunate. I went to medical school interested in nutrition and brain health, had no real thoughts of psychiatry as a profession, and ended up coming out as a child psychiatrist, as a psychopharmacologist prescribing medicine, and very quickly realized that symptomatic-based medicine in psychiatry is not the answer. It's a tool that is just not as effective as we wanted. So I very quickly got back into the reasons why I went to medical school and started pursuing a career in nutritional psychiatry, as I've kept one foot in traditional psychiatry. So my goal is to bridge our current model, which is just symptomatic-based treatment, into looking at kind of root cause functional medicine model for anxiety and depression.
Wonderful. So given the post-pandemic environment, it seems there's an even larger percentage of people out there experiencing uncomfortable symptoms in these areas. What's the current status of that? What are you seeing?
Well, I mean, before the pandemic, depression was quietly had the label of the number one disability globally, meaning more individuals were impaired with depression than any other chronic illness, including arthritis, diabetes. And so it was a global epidemic before the pandemic, but we've certainly heard increased rates of mental illness, tragically among our youth, but also adults. So the numbers are staggering. Clinicians are overwhelmed. The number of prescriptions are also increasing, where some estimates 1 in 10 individuals have been taking antidepressant medications in the United States.
Wow, that is a staggering number on medications. I'm really curious, do you feel like there's more contributing to these increased numbers than the pandemic environment? I know that the isolation and those types of things have had a lot to do with it, but do you see other things like social media and other aspects of our current world that seem to be making the issue worse?
Yes, I mean, all my work is based on putting all the factors, the biological, the psychological, and the cultural. So it's just, and I often use the analogy of, kindling, a fire that becomes a significant out of control forest fire. And things that add would be everything from social media to our, society around the isolation, but also our diet, our lack of connections, and inflammation is just a powerful thing as well, based on multiple infections, not just COVID. So there are multiple factors kind of coalescing, hitting our youth, who are the most vulnerable, and our elderly, and our current, increase in suicide rates are just the result of this ineffective model that we currently have.
And, Dr. Greenblatt, just speaking to those two populations that you just said, the youth and the elderly, just anecdotally working through COVID with people, the elderly people that live alone, it was devastating, to not have that community. And then having two children in high school living through the pandemic, equally as devastating. So not being able to get out of the house. As parents, I think there was a little bit of joy in saying, oh, we're home with our children and we can play games and have family dinners and do all the things that we don't often get to do. But from their perspective, not being able to be with their friends and be independent, it was really difficult to watch, both of those populations. So talk to us about the main symptoms you see associated with these type of disorders.
Sure. I mean, some of the symptoms of depression and anxiety are symptoms that you and I might have every day, but when they're kind of collected and impair functioning. So for depression, it would be, a chronically sad mood, feelings of hopelessness and helplessness, and then often physical symptoms like a poor sleep, and oftentimes either a decrease or increase in appetite. But the overwhelming kind of emotion is this feeling of unrelented sadness and hopelessness.
Okay.
And
I was just gonna, sorry to interrupt.
Yeah.
I was just gonna ask real quick. So, and when you say chronic, what time period, what time period might be okay to feel sad when something's going on in your life? And then at what point does that become chronic?
Yeah, and that's going to vary from individual, and too many individuals are just used to feeling sad, and they don't understand that they've been struggling with depression because they think that's what their life is like. But I think if someone has a stress or a trauma or a loss, it is certainly appropriate to feel sad and to grieve, and that could be weeks or months. But if the level of depression and despair starts to affect your physical health, like sleep and appetite, and it persists for weeks or months, then it's time to address and get some help, at least begin to talk to somebody.
Makes sense. So I went to the Anxiety and Depression Association of America website just to get a feel for what's recommended out there in terms of conventional treatment. And when I looked at what they recommend for the primary ways to treat anxiety to begin with, they mentioned therapy, medication, and then there's a block called complementary and alternative treatment, but that's primarily stress management, some meditation, acupuncture, and then something called transcranial magnetic stimulation. I'm pretty sure that your approach varies from this, and I'd love to have you share with us the main areas that you start with to work with someone to begin to address and manage their anxiety, and how that might be different from those conventional recommendations.
Sure. I mean, we never use the word alternative because what we do is not alternative, it's just good medicine.
Mm-hmm.
And certainly there might be a role for medicine, and there's absolutely a role for therapy. But what's missing from that website and so much of our practice is the underlying, what we call root cause, and other physiological parameters that might make somebody more prone to worry, more prone to anxiety. And so our approach is looking at nutritional risk factors, looking at the gut, looking at genetics, and being able to kind of personalize a treatment plan based on that individual. And oftentimes we do find these environmental nutritional risk factors that can be treated.
Can you go into some more detail on some of them? I think our listeners would love to hear a little bit more about that. Are there some specific nutrition things that you look for, like maybe what is included in the diet versus what isn't included in the diet, and then what you're referring to in terms of gut health?
Sure. I mean, there's some, one of the most common nutritional deficiencies that we see with anxiety, and I use numbers like 95% of individuals seeking help would have a deficiency in magnesium. It's a mineral that when our stress level goes up, we excrete, magnesium goes down. It's very hard to get adequate magnesium in our diets, and lots of foods in our diet interfere with magnesium. So that is the most common nutritional deficiency we see. It affects sleep, it affects anxiety, and affects kind of GI function. But there are also other deficiencies that would take a blood test to ascertain, like looking at vitamin B12, common with individuals with anxiety, particularly panic disorder. Other B vitamins, also common. And the gut relationship, there are some tests where we can pick up markers from bacteria in the gut that actually can increase anxiety in the brain. These are metabolites of bacteria in the gut. And again, not everybody with anxiety has all of these different things, but our job is to look at the kind of root cause for you or the patient sitting across from us.
So you use the words, I think, nutritional risk factors, which I haven't heard before. I like that terminology. Is that referring to nutrients that might be missing in the diet, or is that maybe things that people are eating that are putting them at risk?
Well, maybe both. I kind of correct our grandmothers when, we say you are what you eat. My line now is you are what you don't eat. And I'm particularly concerned sometimes about our vegan colleagues or adolescents that aren't getting adequate nutrients like amino acids, zinc, and B12. And so I think the best way to think about it is if you think of the brain as the most metabolically active organ, it's only 2 to 3% of body weight, but using 25% of our metabolic energy. So any nutritional deficiency is going to affect brain function, how we think, how we feel, and how we behave before other physical manifestations. And that is often missed in our traditional medical model where nobody gets trained in nutrition.
So this is a little bit of a bold statement, but would you say that a vegan diet is a nutritional risk factor?
It's absolutely, doesn't mean you have to eat meat, but you have to be very careful about zinc, B12, and amino acids. And many of our adult vegetarians or vegans are more conscious of their diet, but our poor adolescents might be eating pasta and soda at a time in their lives when they have higher needs for zinc and other nutrients to get through puberty. So we've seen a lot of mental health crises in vegan adolescents.
That makes a lot of sense. What are some of the nutritional risk factors on the other side, as Diana sort of alluded to, with things that people may be eating that put them more in harm's way or at risk of some of these symptoms?
Well, the ultra processed foods, the refined sugars, small amounts is unlikely to provide significant damage. But again, some of our adolescents, some of our adults eating lots of processed food, I refer to this as nutritional vacuum cleaners. So you just kind of steal nutrients to metabolize the sugar and particularly the B vitamins. So one becomes deficient in B vitamins, fatigue sets in, and then that could unravel symptoms of depression. Again, we're always balancing someone who might have a genetic vulnerability for depression with some of these environmental changes or these nutritional deficiencies.
So I've got two things on my mind here. The first one is when we mention processed foods and ultra processed foods, I'm finding when I'm talking to people now about that, they equate that with the Oreos in the cabinet, but they don't necessarily equate that with the fast food that they grab for dinner 3 or 4 times a week to feed their family. And so I just want to make sure we're being clear that when we're talking about processed foods, it includes that whole gamut, right? Like there are some healthier versions of fast foods that can be grabbed, but the typical fried chicken or hamburgers and French fries don't really cut it as a whole food and fall more into that processed food category. Correct?
Absolutely. And,
Yeah.
and again, there are going to be some that will be much more vulnerable, and that could
Mhm.
be the difference between their mental health and not, and others are going to be okay.
Yeah, and I really think about this with our adolescent population because as I look at the high schools specifically, so many high school cafeterias have made a turn to include small fast food restaurants as part of the options for kids to use in terms of being able to buy food at school. And so you know, this is what they're eating on an everyday basis. It's not just occasionally, unless they're bringing their lunch to school themselves and bringing something different. So there's so much, so much opportunity in this area just to clean that aspect up to help our adolescent population be able to feel better, right, mentally. And
Absolutely.
yeah, and so then you mentioned the genetic issue. Can you go into that a little bit more? I don't want to make it too complex, but I would like to maybe have you explain that a little bit more about that relationship and how you go about looking at that for what might put somebody more at risk genetically.
Well, it's really simple. It's just asking a family history, I have to remind doctors, um, but we need a 3 generation family history. So it's your parents and your grandparents and your aunts and uncles and relatives. And so if you have family history of depression or suicide attempts or substance abuse or anxiety, that does place you at higher risk. We know that. And I think that just should make people more aware. And that genetic vulnerability doesn't mean you're going to get depressed or get anxious, but one would just have that higher risk. So it's very simple. It's just asking a lot of questions and understanding your family history.
Okay.
And I like what you said that can put people at ease too, that just because you may have the genetics and that family history doesn't mean that you're destined, but maybe you just have to pay more attention to some of the things that you teach.
Absolutely. Yes.
Yeah. I would love to know a little bit more about some of the other lifestyle factors that may be helpful. So I'm thinking exercise, I'm thinking sunshine, appropriate sleep, that kind of thing. What can you teach us about that?
Well, you hit the trifecta. Absolutely. There's not a better antidepressant than exercise. So we know that. I mean, that's a physiological fact. But think of some of our depressed patients, friends, or colleagues. They're not really motivated to exercise and get to the gym.
Mm-hmm.
So we have to really encourage just a movement. And often we need either supplements or meds to help them make those lifestyle changes. So exercise is the simplest and the best, but often the hardest. Sleep is probably the most important. Sleep disrupts our mood in many different ways. It creates an inflammatory cycle in our bodies, and we have to help teach our patients, our clients, and about the sleep hygiene and the importance of sleep. It is critical, and it also recently been shown to be a risk factor for suicide in those depressed individuals.
And so just to be clear, because I haven't heard that before, and this may be very helpful for people. So exercise is so important, but you said often the hardest thing. And sometimes a medication can help to just bridge the gap so that person can feel more motivated to at least start exercising, which will then start things moving in the right direction.
Yes, I mean the work that we do, we call it integrative psychiatry, which means we haven't thrown away our prescription pad.
Okay.
Someone needs a medication, but oftentimes it could be a B12 injection that gives someone the motivation to begin to exercise. But we need to support our patients biologically And I think one of the most important messages I can share is take away the blame and the self-blame that the failure that they couldn't get over this depression, or they can't stop these panic attacks, because these are biological phenomena that need to be treated biologically.
Sure. And I'm thinking as you're talking about this, and I'm circling back around to the gut health a little bit, and you're talking about B12. And one thing we know is that sometimes there are these bacterial metabolites that can disrupt the ability for the body to absorb B12. So there are some people that can be trying to eat a good diet, but may not be absorbing B12 the way they should be because their digestion or their absorption is compromised in some way. So are there some other connections that you could make to expand on that gut health and how the gut is related to what people equate more as the brain chemicals versus what's made in the gut? What is that relationship, and can you expand on that a little bit?
Sure. I mean, I think important point that you described, that dietary intake doesn't always reflect nutritional status. So many of the patients that we're seeing now are eating the perfect diet. They're, getting their organic foods and flying their fish in from Alaska. And we look at testing and they're deficient. And it could be a problem with acid in the stomach, digestive enzymes, or as you described, gut health. So an important part of a functional medicine approach in psychiatry is testing. We can't get all the information we need based on diet history. So we need to assess and then treat. And as you described, the gut has lots of communications with the brain directly. And so inflammation in the gut can create anxiety and depression in the brain. And there's research to support that.
Right. So it always brings me back to the basics, and it seems like we come around to this in these podcasts quite often. But just some of these basic things about how we eat, the environment in which we eat, just mindful eating, being able to actually sit down and enjoy a meal, enjoy our food, and fully digest that food without being distracted, to allow just the basics of absorption to happen. So I think a lot of people spend a lot of money on trying to get high quality food, organic food, whatever. But if you're going to sit down, or if you're not sitting down, you're standing up and eating your food on the run, or not really sitting down and allowing your digestion to take place, you're missing out on all those great nutrients that you purchased. They're not actually going to get absorbed into the system. So sometimes just going back to the basics and sitting down and eating, chewing your food thoroughly like your grandmother told you to do, getting enough sleep, getting out and getting some sunshine and some exercise. These are basics that we just can't overlook for our mental health. And I wonder how many people today are struggling and seem to be struggling more than what maybe we felt like we did growing up, because some of these basics are not prioritized anymore.
Yeah, I think you're right. I mean, you mentioned sunlight, and we've talked now for a couple of years now the importance of vitamin D from the sun. And but what has been clear through this COVID is that it's not just the vitamin D, but all the other aspects of sunlight, the other light can affect health. So it's critically important, and the role of being outside is really just beginning to be appreciated for mental and physical health.
Yeah, we like to call it vitamin N, vitamin nature, because I think it really is a vitamin.
Absolutely.
Yeah. So talk to us a little bit about, depression versus anxiety. So, because you hear them bundled together often, I suffer from depression and anxiety, or so forth. So did they affect different populations? Are we looking at different symptoms? Talk to us a little bit about any potential differences there.
Yeah, I mean, the differences, are distinct, but so many of the patients now will use the terms interchangeably. I am depressed and anxious. And the anxiety might be the physical symptoms, the nervousness, the heart rate, the sweaty palms in certain situations. And then the depression is the emotional mood and the sadness and the hopelessness. But it is rare now to see somebody, with just pure anxiety, except for maybe panic attacks, and people with depression. So I think they're interrelated, certainly in those seeking mental health treatment.
Why is it rarer now to see them individually?
I think because our society and culture both has gotten more complicated, but also more awareness, and people are talking about it now. So people, particularly a younger generation, they're much more comfortable talking about their feelings and saying words like "I'm anxious," "I'm worried," and that's been helpful, but also kind of making it the distinction between depression and anxiety sometimes harder to tease apart.
Are there different causal factors for depression versus anxiety? Or different roots, do you think? Or do we go back to the same things that we were talking about before?
Well, I think that this, let's take vitamin B12, which is just a great example, because there's no such thing as a vitamin B12 deficiency symptom. We've seen panic attacks. We've seen severe depression. We've also seen somebody who's lost touch with reality. So it is really that combination. We call it G times E. So it's that genetic vulnerability, and then that environmental insult. And so genetics, you have 3 generations of anxiety. And if you become B12 deficient, you might have panic attacks and anxious. But your neighbor might become sad and depressed because of their genetic vulnerability. So we don't have a gene for depression. We don't have a gene for anxiety. There's probably hundreds of genes that kind of coalesce. But my work is focused again on this root cause, which often comes down to these nutritional factors, which vary from individual to individual.
If you were going to recommend sort of a general diet for people to follow that tend to have these different types of symptoms, what are some of the favorite foods that you might put into that recommendation?
Well, the umbrella diet would probably have to have the word Mediterranean in it. And I think adequate protein, fish being the best. But I think too many individuals are just focused on carbohydrates because they taste good. But we have essential needs for fat, which is essential fatty acids, and we have essential needs for amino acids from protein. We don't have any essential needs for carbohydrates. But a well-balanced diet would include, as much, plants and vegetables and adequate protein and adequate, nuts and seeds.
When you
I'm
talk
not a fan of any kind of rigid diet like vegan or keto, unless it's very specific purposes. I think most people, particularly with mental health challenges, will do better with a balanced diet.
Do you have a more targeted recommendation for what adequate protein means for someone?
No, because this will be the obnoxious answer to all your questions. It really varies, and everyone is different. And again, a genetic difference, but also the amount of exercise we're doing, whether we're going to the gym or just walking around the block, and very significant genetic differences as well.
That's the sign of a really knowledgeable clinician is it depends.
And that's, I think, been our disaster in our mental health field, because people aren't individualizing treatment. Everybody gets a medication. Everybody gets a second and third medication. Nobody's looking at that individual differences. And that's, I think, one of the tragedies we're facing in our mental health treatment.
I think we can all agree, Kristen and I see this, that most people are under eating protein. It's quite prevalent. So I think just, and I'll just tell people, just prioritize protein at every meal. Just make sure that you're getting some in, because often, when we look at people's diet logs, there's not a lot there. I mean, there's a couple meals a day without any protein even. So yeah, especially for women and especially younger people. So
Yeah, I mean, I have seen, a lot of my work in the hospital the last 25 years has been in the field of eating disorders. So working on an inpatient unit with patients with anorexia and other restrictive eatings. And I've seen very significant behavior problems like cutting and self-injury completely resolve by just getting adequate protein. Again, these were kids that were eating a vegan diet, got severely depressed, and started cutting. And as these dietary changes were made, their brain wakes up and they feel better.
That gives me such positive energy and really just kind of goosebumps, because, to think that, I'm just hoping there's people listening out there that are seeing some of these issues happening maybe in their family or friends, and they can just take even that small piece of advice and know that, they could start to see improvements. It doesn't have to be complicated, and it doesn't necessarily have to be major medications to see their loved ones and those that they care about start to feel better. So I think that's awesome. You've written books on so many mental health topics relative to integrative approaches, including Alzheimer's, antidepressant withdrawal, eating disorders, ADD, ADHD, schizophrenia. Is there a common thread that you've found between the mental health issues as you've written these books and talk about approaches to dealing with the different issues?
I think the common thread is what we've been talking about, is that understanding, appreciating your individuality, and that you can't just read a book. But what you can do is understand your genetic, liability, and then what's going on now. And psychiatry is the only field where we have no objective tests. If you go to any other doctor and you have an ache or a pain or a cough or chest pain, we're going to do blood tests and x-rays and CAT scans. We're going to find out, is it a migraine or is it a brain tumor? But for psychiatry, it's just symptomatic based medicine. So my message across all the books is just, don't guess, is test and try to understand what might be contributing factors. And what we do is go through all the hundreds of possible factors that could be going on and trying to simplify it. So it's really appreciating your individuality. And if you can do that, there's clearly hope in a field that is pretty hopeless oftentimes for too many patients.
That's great. What else would you like to talk about that we haven't touched on? So any other insights that you wanted to share, any additional topics that you'd like to cover?
Sure. Most of my work is biology and testing. But psychotherapy is critically important. But what we found is that if we can optimize brain function with nutritional support and this individual treatment, then psychotherapy becomes much easier. Someone can participate in psychotherapy, as well as all the other lifestyle changes we recommend to patients, and they say yes, and they just can't do it. And like exercise, like, yoga or mindfulness. I mean, powerful changes of the brain take place if we can get someone to learn how to relax. But that takes a optimally functioned brain to do that.
I'm seeing or hearing from you how important it is to bridge that gap into, things like exercise, things like psychotherapy. So to really start with a foundation of nutrition and lifestyle. That's really interesting.
I do think our kind of nutritional health is has to be a priority, and then we can just add layers to kind of enhance our health and most importantly our self-esteem and sense of meaning and purpose with our careers and our lives and our connections to family.
I'm curious with, all the work you've done and the success that you've had, how how is psychiatry in general beginning to come around to this more integrative approach? Are you seeing more and more practitioners getting involved in bringing in the nutritional aspects and some of these other aspects into the practice? How how much traction are we getting in this area?
Well, the good news is we're getting some traction. It's beginning. It's changing. Absolutely. Most of our work now is training other doctors, and this year we've had an explosion of interest in integrative and functional psychiatry, particularly our younger doctors and some of our older, doctors who are frustrated with this polypharmacy model. So the tide is changing, and people are interested. Consumers are driving some of the demand, but our physician colleagues, our dietitians, our naturopaths, primary care docs are also looking for this information.
That's good to hear. It's good to hear that
Yes.
we've got a movement going on, and you're definitely leading the way with that. It's wonderful.
And it's such a hopeful message that the tide is changing and you're seeing all of this interest. And I could see how people suffering from anxiety and or depression really need hope.
Absolutely. I mean, I do think our current model where patients feel like guinea pigs because one medication doesn't work and they're just adding the second and the third. It's just it's really tragic, and it has nothing to do with socioeconomic status, um, and it is just the field. And so people give up hope pretty quickly because the medicines have not helped, psychotherapy has not helped, and they're still feeling terribly. So a functional model so does provide hope because it helps people look at what's going on with them as individuals.
Yeah, mental health issues really are kind of an equal opportunity type of condition, aren't they? It doesn't really matter what walk of life you come from, depending on the factors that you've mentioned. We can all have similar susceptibilities. So it's
Absolutely.
yeah.
So one of our favorite questions to ask our esteemed guests is, because you're the expert, we'd love to know how you incorporate these different things that we've talked about, nutrition and lifestyle factors, into your life personally. So what do you do to maintain your health and vibrancy?
Well, I mean, I think purpose and meaning is probably one of the most powerful drivers of our health and longevity. And so for me, purpose and meaning has been educating others. So continuing to provide these educational platforms has been very important to me and kind of keeps me excited and passionate and trying to learn more to help train more. But certainly, over the years, we all know what to do with sleep, exercise, lifestyle, and yoga. From early on in medical school, I was living in an ashram, to, eating junk food during internship and staying up all night. So, over the years, you just begin to learn over and over again, appreciate just the basics, as you said, which is sleep hygiene, which is diet, and which is movement and connecting to others.
Yeah. So you may have just answered this question, but if there was one piece of advice you might give someone out there that is currently struggling with anxiety, depression, or really any other mental health issue, what's the one thing that you would say to them today?
Stop blaming yourself. This
Mm,
is not a failure. This is not a weakness. This is not a disorder of willpower. These are biological illnesses, genetic risk, and seek somebody who can help look at some underlying causes. And it doesn't mean you have to be afraid of medicine, but medicine can't be the only answer.
oh, that's wonderful. I love that. I mean, it's not a blame game, and we can't blame ourselves. You said there's so many factors beyond our self-control that contribute to this. So I think that's really a good message to reinforce. We're not at fault. Dr. Greenblatt, this conversation really offers hope to so many people dealing with different degrees of feeling mentally unwell. So, and we know it's much more than just about the mind. It's the whole body that contributes to those feelings, especially after our conversation with you here today. So in addition to, how would our listeners find out more about you, your approach, and the resources that you have available?
Sure. I mean, our educational platform is a website called Psychiatry Redefined.org. And we have lots of free content and then courses and trainings for professionals. And the books and my work is on my website, jamesgreenblattmd.com.
Fantastic. Thank you so much. We know how busy you are, so we really appreciate your time and know that this is an incredible message that's going to help a lot of people. So we can't wait to get it out there. Thanks a lot for your time.
Thanks for inviting me. I appreciate the opportunity.
Yeah. And thanks to all of our listeners out there. We really appreciate you. We look forward to seeing you next time. Until then, be well.
If you'd like to access other episodes or subscribe so you don't miss a beat, you can find us at nanp.org/NANP-podcast.
Membership in the NANP provides you with a competitive advantage. Whether you're a current practitioner or a student, we want you to become an active, informed leader of the holistic nutrition community and join today at nanp.org. NANP is very proud to provide the highest level of professional recognition and validation in the holistic nutrition industry through the board certification in holistic nutrition credential. To earn this valuable designation, candidates must demonstrate an exceptional level of knowledge and understanding of holistic nutrition by passing a board exam and documenting client contact hours. Are you ready to boost your credibility with board certification? Visit nanp.org today to apply.
Keep in mind that the information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights reserved.